Hi there, my name's Damien. I'm a paediatric emergency medicine consultant at the Leicester Royal Infirmary. It's really difficult if your child's had a serious illness or inflammatory condition in the past. They may have been admitted to hospital for a couple of days, if not longer, and they still may be suffering side effects of that particular disease or admission. What do you do if they get a simple fever, a cough or cold again? In your heart of hearts, you know it's likely to be a viral illness, but you're clearly aware that this condition could deteriorate, and you clearly don't want them to become unwell as they did before. I think there are a couple of sources of advice in this situation. I think you should always try and make an appointment with your GP if you're concerned about the illness that your child has. But it is always worth remembering that you are the best arbiter of how unwell your child is. And if you're just worried about the fever or just worried about the cough and cold, but actually your child's playing, seems quite happy, perhaps that fever responds to simple antipyretics, so that those are things like paracetamol or ibuprofen, which reduce the temperature, then that's probably a good thing. And I think you've probably learned from the previous condition that when children are really unwell, it's not just the fever or cough, it's usually their whole behavior that changes, or they may have other features such as a very high breathing rate, they may appear quite mottled, they may be very lethargic. So you can go with your gut. The likely thing is that your child does have just a simple viral infection, it will go away. If you do need some help, you can contact your GP, or you can phone 111. You can visit your pharmacist as well. If you're not really sure whether this is a simple or more complex case, they may well be able to advise you. And it is worth trying those routes first, rather than going straight to an emergency department. Sometimes the waits in emergency departments can be quite prolonged, and during the winter, those long or what can be very long waits mean that it's not a very comfortable position for your child to be in. As always, though, if you're very worried about your child, that they're having a seizure or have had a seizure, that they're impossible to rouse, then you do need to seek medical help as soon as possible. Thank you very much.